Hello, everyone. Thanks for joining us today. I am Bara Vaida. I am the core topic leader on infectious diseases for HCJ. And this is one of a series of webinars focused on health topics in the news. And today's topic is national health security. Though the government has ended the public health emergency from COVID, threats from infectious diseases, whether they're brewing in nature or maybe even bad actors in laboratories, are not over. In nature, we've got an avian flu epidemic that's still continuing. And on the man-made side, we've got new high-risk pathogen research labs that are opening across the world as other countries, policy leaders, political leaders continue to debate how best to regulate these labs. And in our bigger picture sense, there's the broader question about lessons learned from this past pandemic. Congress is considering legislation this year to implement some of the lessons learned. But some of the questions is, what have we learned? And will this be incorporated in legislation, or are we just dropping everything that we learned and just kind of pretending like nothing happened these past 3 years? So here to help us with these questions and to put this topic into context is Ambika Bamba. She is the Deputy Executive Director of the Bipartisan Commission on Biodefense. She previously was Deputy Executive Director of the President's Council of Advisors on Science and Technology for President Biden, and was the Health Science and Technology Advisor for Department of State's Crisis Management and Strategy within the Office of the Secretary during the pandemic. She helped bring home 100,000 Americans that were stranded across the globe at the very beginning of the pandemic in 2020. Ambika is a fantastic resource. She's got a wealth of expert information for us. She's here today to talk about what reporters need to know about zoonotic threats, the biodefense of animal agriculture, the reasons to keep writing about pandemic preparedness, particularly given legislation that's pending in Congress. So there's lots of news hicks here. She'll also speak to what kind of government plans required to reduce the risk of another global pandemic in the future. So Ambika will offer about 15-20 minutes of presentation, and then we'll go to some of your questions and my questions. And you can put those questions at any time by typing them into that Q&A section at the bottom of the screen. Please don't put it in the chat section. We'll be able to see them and I'll direct them to Ambika. So Ambika, thank you so much for being here. Please go ahead.
Well, thank you. I appreciate this opportunity to speak with all of you. Keeping this in the limelight and the importance of it is such a critical part of making sure that we put the right things in place to prevent the next major outbreak turn into a pandemic. And so I appreciate this opportunity. I'm going to go ahead and try to screen share here. So please let me know if everything is good. Can we see it all?
Yes.
Awesome. Well, like I said, I'm going to cover a couple of, I appreciate this time to talk to you, and I'm going to try to speak to why this is important and what is going on right now that makes it particularly relevant, because we've been hearing about pandemics for a while now, and why all of you hopefully can report about this and what might make it more attractive to keep it in the news. So I'll begin by first introducing to you the commission where I work currently. The Bipartisan Commission on Biodefense was established in 2014. It's funded by the private sector, and we don't have a congressional mandate, but we operate like a congressional commission. So the commission has, for a few years now, been providing a very comprehensive assessment of the state of U.S. biodefense efforts that are across the entire government. So that's the executive branch, congressional, looking at all aspects of biodefense, because it's very piecemeal in different parts of all the different agencies. But the commission also doesn't look at this in a completely academic way. It's very much about pushing forth policy. So what are actionable recommendations? And then speaking to folks about those actionable recommendations to help think through the entire process. So this is from prevention, deterring, detecting, responding to, how do we attribute and know where it came from, recovering from, and then mitigating the next biological incidents. The first and the seminal report that the commission put out was in 2015, and it was a national blueprint for biodefense. There were 33 very specific recommendations in that blueprint that have really formed the basis for a lot of the work the commission's done. And if we had had that in place, life would have been very different the last couple of years. at the moment, the commission has, these are our commissioners. So we have 8 commissioners. It is a bipartisan commission. That's very important and key to this organization. We are co-chaired by former Senator Joe Lieberman, who was a vice presidential candidate back some years ago. Former Governor Tom Ridge, who was the first Secretary of the Department of Homeland Security, Representative Donna Shalala, who also was Secretary of HHS, Senate Majority Leader Tom Daschle, who received one of the anthrax letters back when those attacks happened. Recently, Representative Fred Upton has joined the commission after more than 3 decades in the House. Representative Susan Brooks did a lot of work with PAPA the last cycle, which we will talk more about PAPA in this conversation, I'm certain of. We also have former Representative Jim Greenwood, who has been very involved with all the biotech industry side of things as the president of Bio in the past, and former FDA Commissioner Margaret Hamburg. So the commission is led by people who really understand how to run government and how to do so in a bipartisan way. They're very passionate about biodefense and come with that perspective of whole of government approach. And so just briefly, I'm throwing up here a slide of the reports that we've put together. And like I said, they're very action oriented. They have specific recommendations to act on across that whole plethora of things that relate to biodefense and biosecurity, pandemic preparedness. So when Bara and I connected and we were chatting about what we can talk about today, one thing that I mentioned is that, of course, we all think a lot about pandemic preparedness in the context of COVID and how it impacts human health. But there's also been some recent news related to thinking about animal and agricultural biodefense. And in particular, the National Bio and Agro Defense Facility is finally opening next week. It's really an exciting bit of news to talk about. This was a 14-year project, $1.25 billion investment. It's situated in Manhattan, Kansas, basically in that corridor of Kansas City's animal health corridor. It's the largest concentration of animal health companies in the world. And what NBAF is a research facility to really understand disease in plants and animals. And how do we think about vaccines for them? How do we think about countermeasures? How do we accelerate the development of these technologies, but also transfer them to industry? And so that's very exciting. It's a really important tool that is going to help the US move forward in thinking through how to defend against viruses that have potential to jump then from plants and animals into humans, but also thinking about just our economic security. This lab is the first biocontainment space, so the first BSL-4 facility in the US with the capability to hold large livestock, and is really going to be a powerful tool. So why is this important? I'm going to put it in context a little bit, the why even report and talk about this again. I don't know if maybe Bara, when you think of the billion-dollar disease, what disease comes to your mind? Or what do you think is the disease that's the billion-dollar disease?
Well, I mean, you just think about COVID.
Yeah.
More than a billion, more than.
Yeah, more than that. The disease that actually is referred to as the billion-dollar disease is not even a human disease. It is foot and mouth disease, a virus. This is not hand, foot and mouth, but foot and mouth disease, which doesn't infect humans, but it's the most dangerous livestock pathogen that could infect somewhere from 70 to 80 different species of animals, including all the livestock that we like, cattle and sheep, but also a number of wildlife species. So if even a single case of this disease is detected, it triggers all these embargoes on trade, the meat industry, and large-scale culling of herds. So it's the disease that everyone is scared about in the scientific world. Luckily, we haven't had to deal with it in any recent time, but we have had to deal with a number of other diseases of course, as was in the title of this this webinar, one is avian flu. This past year and a half, we've been having a pandemic related to HPAI, and that has caused egg production to drop by 2 billion, which then led to egg prices that have skyrocketed and have been double the 5-year average. Another example to put in context, everybody might remember the mad cow disease that caused U.S. beef to be barred from importers barred U.S. beef, and ranchers and processors lost $11 billion. There's an economic consequence to our some of these diseases. When there was an outbreak of carnal bunt in Texas, 25 countries banned those imports, also leading to large economic losses of $250 million for those farmers. Sorry, and I should mention that's wheat. So you can imagine if this happened again, or it was more widespreading, how much it would impact our own food supply, and along with how we export wheat. It's also gotten to the point where there have been certain species of fruit that we enjoy that were almost extinct. For instance, the papaya ring spot virus led to the almost extinction of papaya in Hawaii, which would have been very sad. My family loves eating papaya, but we genetically modified and were able to prevent that from continuing. But there's a lot of consequence to viruses in plants and in animals. Viruses actually account for 50% of plant disease across the world. And that results in estimates that are on the low end, $30 billion of economic loss annually. And there are much higher estimates that exist out there as well. So what is very clear is that animal and agro-security go hand in hand with regional stability. And one of the reports that we've written that really dives into this a bit more is the defense of animal agriculture. Actually, I should have put up another one that we put out recently, a few months ago, last year, called Boots on the Ground, which talks about policies on how to better defend our food and animal agricultural environment for biodefense purposes. The reason that this is all important right now is because this is a very unique year. There are certain legislative vehicles that happen every year where that can become opportunities for improving on biodefense policy, but there are certain ones that only come around twice a decade. And one of those is, the first one that I'm going to talk about is the Farm Bill. So the Farm Bill is an omnibus bill that really covers and governs all of the agricultural sector. It, as you would assume with the name, it includes farm income support, food assistance, things like food stamps, farm subsidies, trade. There's a variety of topics that go under it. And it's a pretty large vehicle. The budget for the estimated cost of the last one, which was in 2018, was about 428 billion. And assuming that it passes in the exact same format, right now the estimates are that the price tag that comes with that is about 73% higher, so closer to $750 billion for the next 5 years. So it's a very large bill and an important one for the citizens of the US. It's renewed once every 5 years, roughly. It is right now, the deadline for it to be reauthorized is September 30th of this year. So it's a very important bill to get done. If it's not done, things like food stamps expire. There's always a chance that they could choose to extend the bill while they're renegotiating things, but it's a very critical piece, and it usually has bipartisan support because of both sides. For the urban side, folks with food stamps, and then on the rural side, the farm subsidies usually brings people together in a bipartisan way, which also makes it a great opportunity for thinking through how do we improve on biodefense related to agro. And so the last version of the Farm Bill, the Agricultural Improvement Act of 2018, did 3 important things. It established a national animal disease preparedness and response program. It created a national animal vaccine and veterinary countermeasures bank, and increased the funding for the stockpiling of some animal medical countermeasures, so vaccines and diagnostics for animals. And it also authorized increased funding levels for the National Animal Health Laboratory Network. It authorized increased funding, but whether or not that actually passes year to year is still something that is a discussion and a negotiation point. And this year, the Farm Bill currently, so the Senate was actually a little bit early. They got all their member input in March. And right now, the deadline for House members to submit their comments is June 9th. So there is, it is moving forward on the committee side. However, because of the debt ceiling issues, it is now being held up a bit because food stamps are one of the things that are being a negotiating factor about the debt ceiling. So we can talk more about that later. But there's a lot of opportunity here to really think through other things to bring in and how to better prevent us having the impacts of things like avian flu on our food supply if we have the right system and response network in place. The other major vehicle that I wanted to talk about is PAPA. And so that's the Pandemic, All Hazards and Preparedness Act. It's a bill that is developed over a number of years because of a variety of different kinds of outbreaks that have happened and things that have clearly been important enough to move some legislation. The anthrax attacks, just talking about the 2000s, the anthrax attacks that happened in 2001, and our commissioner, Senator Daschle, was one of the ones who received those letters. We've had SARS, we've had H1N1, we've had MERS. The more biological weapons kind of oriented things like the ricin attacks that were mailed to President Obama and Senator Wicker and a few others. Ebola keeps on breaking out repetitively, Zika, and the 1.5 million people that were infected there, and all the children who got I'm sorry, I'm mispronouncing this, microcephaly, unfortunately, during that time. And then, of course, COVID, which many of you have reported on and know the numbers and stats and the impacts of it across every aspect of life. Of course, we've had Mpox and then now chikungunya, and there are outbreaks of Lassa fever happening again. There are continual outbreaks that are going on. So all of this makes it so crystal clear that biological threats, whether they're naturally occurring, like you were saying, Bara, accidental or intentional, history shows us that we can't just assume that pandemics and other things are rare or once in a century occurrences. They can happen and will happen, and we have to prepare for them. And so just one quick slide on PAPA's legislative history. It is also one of those vehicles that only comes around once every roughly 5 years. So this being the first time that it is up for reauthorization after having gone through COVID makes it a very interesting year. It's also very politically charged, given the climate that we've gone through. But to sort of give some of the history of it, when it was originally, the first version, one of the earlier versions of it was in 2002, and it set up the National Disaster Medical System, the funding and guidance for public health emergency preparedness and response, among other things. 4 years later, that's when it was renamed PAPA, and ASPR was created, which is the Assistant Secretary for Preparedness and Response, which is really about how we respond whenever there's an ongoing pandemic. It advanced the development and acquisitions of a number of medical countermeasures and required that there be a quadrennial national health security strategy. In 2013, the hospital preparedness program was put into place, public health emergency preparedness, cooperative agreements, and more investments were made into medical countermeasures. Project BioShield Act was under the umbrella. The medical countermeasures were under that umbrella. And some of FDA's authorities were enhanced for being able to respond during a public health emergency. Then the last version, which our commissioner, Susan Brooks, really worked on a lot, was the one that happened in 2019. So it enhanced authorities for ASPR and CDC. but not to the level that clearly the pandemic showed us that we need. New public health and medical preparedness programs for regional healthcare preparedness and military partnerships were established, and it defined the uses for the Public Health Emergency Fund. Now we are in 2023, and have lived through a pandemic and have learned a lot, but whether those lessons get incorporated into this next version is a question. How much will happen? How much will get authorized? How much will get funded? There are a lot of questions here, and I'm sure many of you are reporting on this as well, and we can talk more about it. I just want to mention what are the agencies that are very important or mentioned in PAPA. There, of course, there's Department of Health and Human Services, and under it fall a number of different agencies that are relevant to pandemic preparedness and response. So the CDC and FDA, as we all know. There's ASPR. And under ASPR is BARDA, which is the Biomedical Advanced Research and Development Authority, and which is where a lot of commercialization of tech that will help us respond to pandemic preparedness or pandemics, that investments into that. But also, I would not commonly realized, there are pieces of the legislation that relate to the Department of Veteran Affairs, Department of Defense, and also the Department of Homeland Security. So there's a lot that can be talked about with PAPA and what opportunities exist there. We've done a couple of reports. We proposed, or the commission proposed, before I joined it, a Apollo program for biodefense, and laid out very clearly technology priorities, the ones that are mentioned here, that if we invested in them now, would take pandemics completely off the table for the future. We can't prevent outbreaks from occurring because there will be natural spillovers and events that happen, but we can prevent them from turning into pandemics. And so this a follow-up report that was that we put out last year really talks about the policies of how to implement and make sure a program like the Apollo program could come into place. And a lot of this has framed the discussions on the American Pandemic Preparedness Plan, PREVENT, and a variety of other things. And so there's a lot of content in there. I'm not going to dive into it all, but just put out there's a lot of thought and potential for what could be done with PAPA. So I want to wrap this up before, sorry, we move into more of a discussion of the importance of all of you. And, you know, we spend a lot of time at the commission thinking about how to have these conversations with folks on the Hill, how to bring bipartisan support, how to frame it in the context of the political environment that is there and policy making. But really, it comes back to their constituents and framing all of these topics in a way that shows the relevance of it to the daily life of every citizen in the US. And you all know this, but it impacts food, your breakfast, your lunch, the items that you eat, food security, and it affects health, obviously deaths and illness. But it has changed how society functions as a whole, how we work. It has impacted our economy, and always tying it back to that to keep it relevant is just so key so that these issues do not lose their importance and they keep being relevant and highly supported on the Hill to put in the investments we need to build our defenses. So with that, I will stop talking and sharing, and happy to start answering some questions.
Okay, great. Thank you, Ambika, for that really comprehensive presentation and helping us frame this topic today. I'll remind our viewers that you can ask questions of any of Ambika by just typing them into the Q&A section. So I'm gonna just start us off with a question of my own. What would you like to see more of in terms of reporting from health journalists on this topic? What have we done well, and what can we do better?
That's a very broad question because there's so much reporting across so many different kinds of areas. I think making it more relevant at the local level. I think there's a lot of good stories that think about the big picture across the whole government, but it makes it somewhat distanced and out of mind, out of sight sometimes if you're talking too high level. Really understanding how things are impacting a local community. So it might be more local reporting of how something is impacting the economy of a certain place, or the facility there, or the food prices in a particular grocery store, and making it a lot more daily relatable. I think that is a key part of also keeping it away from politics and making it important and relevant, and continuing to stay relevant beyond obviously what we saw with the pandemic.
Well, I'm just sort of speaking of how to localize this. Could you talk more about this, the lab that's opening in Manhattan, Kansas? A question we got was, can you talk about the health threats posed by the concentrated animal feeding operations, which there are going to be there are a lot of right near this lab, and how that relates to, economic security.
Yeah. Thinking about if we're talking about animal health first, it's very complex. You're right in that when you congregate if you congregate animals, there's a lot more opportunity for disease to spread across that animal population, but also opportunity for it to cross over. So there have to be more processes for how you're dealing with waste, how you're dealing with feeding, how are you trying to prevent the way that disease is spread, but also how you're monitoring it. And right now that is more talking about animals that are more domesticated or commercialized, but there's also a lot to think about when it comes with wild animals. And unfortunately, really, we are so under-resourced in understanding how any of that works on the scientific side, because there have been limited investments, and it is somewhat politically charged. For instance, we are now aware that COVID is widely in wild deer populations across the US. And it happened because of a couple of researchers who got permission to start testing, but that permission was later revoked because then state authorities start to worry about how it might impact their tourism and other kinds of things as well. And so there's so much politics associated with it. The first things to get cut are usually animal and plant research that might be politically charged. And so what is really powerful about this facility is that it is an investment that has been put into place. They're going to be covering, there's a list of, don't quote me on the number of, it's on their website. There's about, I want to say a little bit less than 10 that they are required to study diseases, including some of the ones that we've already spoken about, and better understanding them, because the potential of those particular diseases to cross over will immediately impact our economy and human health. And so that area is concentrated with a lot of animal and farming and industry related to animal health and whatnot. But having that resource there where they can immediately bring the animals to the facility to analyze what is going on and test will also help empower managing it. The thing is there are policies we need to put into place that will help to then respond when something occurs. So a response network, how do you coordinate with local, state and local territorial kinds of folks when you're seeing animal deaths? Or like if you see a bunch of dead birds, people now are a little bit more aware that they need to start reporting this, but it's similar sort of education on other things to keep an eye out. But in responding to that, those are things that we need to invest in more. We also need to take more advantage of things that we've already put investments into. For instance, land grant universities. They have been funded to better coordinate in a lot of these research capacities and to coordinate with local state organizations, but we haven't utilized them to their full extent. And so there are opportunities in the Farm Bill where we could talk about utilizing things we already have in place better as well.
Thank you for that. There's a follow-up question, I think, which was about, where was permission revoked for the testing of deer? Where did that happen? Interest.
I think it was Iowa, but I'm not sure. So maybe we can follow up and answer that question after.
Yeah, this, yeah, because we have your contact information we'll provide, so the person who asked that question could follow up with you.
Yeah.
Uh, let's go actually over to kind of more on the pandemic preparedness for humans.
Yes.
And, what would you, what would you hope will happen in the Pandemic Preparedness Authorization Act that would set us up better to prevent another pandemic? I know there's a question here, and I think it's sort of related to, are you addressing backup capacity at hospitals, reserve forces at healthcare workers, backup manufacturing vaccines, PPE equipment? Is this the kind of thing that's going to be addressed with this reauthorization?
Yes. So one of my favorite quotes that I think relates to this entire space is something that Benjamin Franklin said, which was, by failing to prepare, you are preparing to fail. This is the right vehicle to really put into place all the things that you mentioned. Hospital preparedness is a program that is enhancing some of the resources for it, is something that is managed under ASPR. It's talking about our national stockpiling. And what goes into it, how is it distributed, how do we manage it, what is the purpose of it? It was created for one reason, and it's now being used in a very different kind of function, and it's now everyone assumes it's something to respond to all kinds of pandemics. It's not how it was originally designed. So the funding of that and how it would be run would be different. Investments into medical countermeasures, the reason we keep talking about that again is it's not commercially viable for industry often, because you're creating a product that may not have a market. And so those only come about through investments by the government. And that is one of those vehicles is BARDA. And partnerships like Barter Ventures and others. There is also.
And that's an agency, right? Just what BARDA stands for, right?
Yeah, that's an agency underneath ASPR.
Mm-hmm.
That was created through PAPA, which is really important, but we have to think about how we're really utilizing and thinking through what areas of medical countermeasures, like what was mentioned in the question, PPE, of course, vaccines and diagnostics and others as well, but also thinking about sequencing, thinking about surveillance technology. So that would be, for instance, wastewater. How are we at the commission have really been talking about a couple of different things. Also, part of this is about having a very coordinated plan about how we're doing this. We do have investments in some of these different areas across different agencies, but having it coordinated in a very strategic plan that then justifies why more investments would happen along further down the line. For instance, a diagnostics response plan. When a new virus emerges, we need to immediately create a diagnostic for it, but it's not just then once it's created. You might partner with industry like we did with the RADx program and Active and then Operation Warp Speed to create some of these medical countermeasures. But with the diagnostics, how are you then distributing it and getting feedback far more effectively than what we did right now? There needs to be lessons learned and institutionalized from what we've gone through, and all of this can be done now through PAPA.
I just want to ask about Congress last year required told the White House to create an Office of Pandemic Preparedness and has not done so yet. Mm-hmm. So I want to know if you know why and if that was the right approach. We'll just start there with that question.
Yeah. So, it's interesting. So if you look at the structure of the White House, there is the Office of Science and Technology Policy, and underneath them is already a group that does pandemic preparedness and global health security kinds of work. So the OSTP side thinks about sort of policy of where we should be moving and what new programs should be considered and initiatives should be considered. Then there's also the National Security Council, which has a directorate called the Directorate of Global Health. And they are the ones who really coordinate all the federal agencies together on biodefense and global health security and pandemic preparedness. And so those two already exist. Then when COVID happened, while COVID and monkeypox were going on, they also created these extra task force kinds of teams that were really focused on just that particular response. So now with what came through in the legislation at the end of last year, under prevent, was this new office that is being requested. So I think what is right now happening is there is a lot of discussion about how to organize, because these two already exist, and where this new office would be created and sit, what authorities and powers would it have that the others don't have, or how will they coordinate together? It's not clear yet. So I don't have an answer about what is happening, because there are some of these work is already happening in these other two offices. And so how to coordinate and create this third office that would not be redundant, I think they're still sorting through what that would be.
I mean, it's still squabbling over who's going to be in charge after all this time. It's amazing. How concerned do you think there should be this should be over in the HHS, the COVID Commission? I think what the organization's called, right? The lessons from the COVID war, the COVID Crisis Commission.
Yeah.
So there should be a Undersecretary of Health Security, I think, at HHS. ASPR, I think, got operational power at this point. So could you talk about what that means? And then we'll get to another question about animal health as well. We'll go back to that in a moment.
Yeah, so you're right. ASPR was elevated to an operational division that gives them certain powers to act faster. But what they need to come along with that are certain authorities related to contracting, related to hiring, that other agencies like DoD have to be effective at their job. And one thing that we've been sort of thinking through here is also elevating then the title of the ASPR into an undersecretary kind of a level. The commission has one of the first things that it really talked about was leadership, and where does leadership sit when you're trying to coordinate something like this, where there's not like one agency that covers everything. There are so many pieces of this. Department of Homeland Security has a part, intelligence community, clearly HHS has big parts, but DoD does, Department of Energy does as well. And so the coordination of that clearly needs to happen high enough that it is a person that can make things happen, that has the authority. And so in the blueprint, what we had originally put forward is that the vice president should lead this. We were sort of thinking through that again, and what might be the right, but the challenge with creating a new separate office is if they don't have the authority to actually convene and push forth policy through all the agencies, then it's not an effective office. And so what needs to happen is there needs to be a clear understanding between NSC, OSDP, and however this new office forms about what will they be doing so that they can actually enforce what comes through in those discussions. If I can.
It's kind of the sausage making problem.
Yeah,
right here,
right.
Yeah. Let's just get to, there's a question here. Someone said, I work as a communications consultant in the pharmaceutical industry, and recently the National Microbiology Lab and the National Center for Foreign Animal Diseases, both Canadian BSL-4, so that stands for this biosecurity level, the highest security level labs, under one roof in Winnipeg, published a study demonstrating that there have been some transmission H5N1 in ferrets. This was a preprint study, so it hasn't gotten a peer review, has not been picked up in Canada or the US. This person asked, they're curious why this might be. And I think that goes to one of the concerns in the community. So let's go back to kind of how do we localize these stories, this community and around where this new lab's going to be in Manhattan, Kansas. There's been a lot of concerns raised about sort of leaks, accidental, could foot and mouth disease get into the cattle? That was one of the things that I saw a lot of concern about. Could you speak to this?
Yes. So I don't know about that particular article because it hasn't been published. I can't speak to why that particular article hasn't been published yet. But talking about this idea of biosafety in labs, definitely that is, there's a lot to digest and think through on how to do it. It's clearly very important. We cannot be naive enough to think that all labs are equally safe and all have the right processes and security measures in place. So the NSAB, which is the National Advisory, I'm going to forget what the acronym stands for. It's the scientific board that really advises on things related to biodefense. It was authorized or approved or something through this last legislative cycle. And one of the things that the commission is strongly recommending is that they reevaluate and really rethink through how the select agent program functions. So what that is the select agent program lists out what are the highly pathogenic diseases and viruses that could turn into that have pandemic potential. How are we researching them? How are we managing them? And what are even on that list to begin with? And so one of the recommendations that we've really been pushing forth is about reevaluating the select agent program, because some of the ways that for instance, technology is changing now. It is very easy for anyone who doesn't have to be very scientifically trained to be able to combine different viruses and create a third kind that may not be on that list. And so right now, which of these pathogens are being regulated and what safety measures are in place for them? It's a good program for the ones that are on there, but we need, and some of these include the ones that are going to be at the NBAF facility. And so the safety procedures and the reporting and the regulatory side of repetitively evaluating are the right safety standards there are very well defined by the select agent program. And a lot of the things that are going to be studied at NBAF will ensure, because of all the checks that have to happen, that those things won't come out from there. But the real question is what is on the list of select agent program and how can it be improved? And so there is a lot of opportunity there. And there's a lot of discussion in the scientific community about improving how we think about it, given how much genetic innovation has advanced in the last 5 years and how easy it is to manipulate viruses. So yeah, we have to have the checks and balances.
And on that front, what keeps you up at night working in biosecurity?
The real thing that it's less for me on the science. So I am a scientist or an engineer by training, and a lot of the sort of scientific and engineering problems I feel are tackleable. Like you can analyze and figure out how to understand it and study it. The part that the reason I've shifted from doing academic and industry work into this now is really getting society behind what comes out. It's the communications piece of it. It's about when you have, a lot of times in the innovation world, you develop something, you just assume people are going to, of course, take it up because it works better. It's going to protect you. It's going to do whatever. It's sort of like the logic of that makes a lot of sense, but the communication of logic and what fears people have around it and how much, I think that's the problem that I think about a lot, is building trust. How are we thinking about communicating? How are we getting people to actually relate to and believe in the information that is being presented to them? So when things happen, we can solve them. It doesn't turn into 1 million deaths in the country the next time around.
So how to solve this
communication, which is why I'm really happy we're having this conversation today, because all the journalists here have a big part in that.
And we're coming close to the end here. And so a kind of final question to go back to the point that you made at the beginning is you'd like to see more localization of this pandemic preparedness question. Let's take a piece of like the hospital preparedness, for example. Can you give an idea of how reporters can localize it? How can somebody in, say, Minnesota or Colorado or Omaha, like how can they write a more localized story about pandemic preparedness now?
Well, I mean, I think this example we're talking about, NBAF, is pretty, as a prime example. It's a really relevant one. It's next week, about how this facility is going to be there, how it's going to impact their local community, the questions it might raise, but also how it will bring answers to solve when there are issues that arise, the jobs it will create. It's making that facility relevant to the local community, and the importance that plays in the national picture, but also the international picture. So using things like that does help make it relevant. Yeah.
Oh, well, Thank you to all of you who've tuned in today. And I want to thank you again, Hempika, for being here. I know that there will be your contact information. I know there were a couple sort of follow-up questions that I'm sure that you would be happy to answer their questions so they can reach out to you directly. And for all of you, HCJ will continue to bring you webcasts in the future on a variety of health topics as part of your membership, and a recording of this webcast and all others will be archived on our healthjournalism.org website for you to review at any time. It will be up on the website later today. Again, you're welcome to reach out to Hempika. You're also welcome to reach out to me if you feel, anything I can do to help as well. So we just want to say thank you again for being with us today, and we're wishing you good luck in your stories.
Thank you.